Assalamu alaikum. Good morning, everyone. I am Meshari Alnuaimi. I would like to thank Mr. for the invitation. And the aim of this conference is to raise the standard of care for radiation oncology application and for patient care, which aligns perfectly with MIFOM's mission. So I will be talking about Middle East Federation of Medical Physics and also the status of medical physicists in the region and future directions. The Middle East Federation of Medical Physics is a regional organization of the International Organization of Medical Physicists, founded in 2009 with 12 member states and a total number of 1,200 medical physicists. We want to enhance healthcare in the Middle East region through the application of medical physics, and MIFOM strives to achieve the following objectives: to encourage education and training, to promote advancement in the field, and also to encourage exchange of knowledge and information. So our vision, based on four main pillars, is the first one is to build confidence among physicists by enhancing the recognition and visibility of the profession throughout the region. Also to achieve excellence by promoting the highest standard and quality of care and patient service. Also to support professional development by dedication to develop and offer continuous education opportunities to support medical physicists and health professionals in the region. Also partnership, which is very important, and this is an example of partnership with MESTRO, promoting collaboration and cooperation among medical physics societies and other health and medical societies globally and regionally. So this is the board of MIFOM, the executive officers of MIFOM. Dr. Hassan Kharida is the vice president, Dr. Huda Naim is the past president, Dr. Rabi Hamoud is the treasurer, and Dr. Rifat Al-Mazrou is the secretary general. The goals and objectives of MIFOM are executed and moved forward by the officers with input from committee chairs. We have 6 committees. Science committee, the chairman is Dr. Mustafa Al-Musawi from Iraq. Education and training committee, the head is Dr. Riyadh Shwaykani from Syria. Professional relation committee, head Dr. Haytham Kanan from Jordan. Publication committee, Dr. Hayb Ashur from Bahrain. Website committee, Dr. Nabil Qaylan from Jordan. Awards and honor committee, Dr. Zakia Al-Rahbi from Oman. So you can see that members of MIFOM from almost all the different countries of the Middle East. So I'll give you just brief information about the current status of medical physics in the region, in MIFOM countries. This is an article published recently in 2021 by Dr. Mohammed Hassan Kharida, the vice president of MIFOM, which summarized the status of medical physicists in the region. And this article contains information about the number of equipment used, the number of medical physicists, distribution of physicists in the region, and also what type of education and training programs available. And you can see that there is a big variation in the number of equipment, number of physicists, and also the number of training programs in the region, mainly due to the ongoing crisis and instability in the region in some countries. So we are committed to support those countries that in need for training and also opportunities to enhance the level of medical physicists. So to give you some facts and figures about medical physicists, the average number of physicists in the Middle East is 8 per million population, which is acceptable, but compared to developed countries, it is it is low, because in the developed country the average number of physicists is 15 to 20 per million population. So we encourage and we are trying to work to increase the number of medical physicists, because there is a need of that. Yesterday we heard talk from Dr. Jaber about the high demand of medical physicists and health professionals in the region. So this is, also important. Also, if you see the distribution between number of male and female physicists, they are almost the same. Regarding equipment, we have about 122 radiation therapy units in the Middle East, which is considered 1 unit per million population, okay? Which is considered low. According to the WHO, the minimum number of equipment per million population should be between 3 and 5 units. So this is, about radiation therapy equipment. For CT also the number is low because we have about 1,850 CT units, which is considered 13 units per million population. And the number of equipment needs to also to be more to serve the high demand of this service, for patient management. Nuclear medicine is good. The number of units per million population is 3, which is considered acceptable compared to other parts of the world. So this variation between countries, mainly due to, as I said, the ongoing instability and conflicts in some MIFOM countries, resulted in different tracks of development for medical physics and radiation oncology in the region, in each country. MIFOM is committed to support the development of medical physics, a profession in these countries, and sustain the support of also healthcare providers. Regarding education and training, 5 countries in the region provide medical physics education, including Saudi Arabia. Some countries provide PSc programs, and also other countries provide master and PhD programs. But again, if you see the table, most of the countries, 3 of the countries, they are, having some conflict and instability. So it's in reality, you cannot, apply for these programs because there is, instability in these regions. For certification, there are no national or regional certification board for medical physicists at the moment. So as an interim solution, MIFOM and some national societies, in collaboration with the International Medical Physics Certification Board, started to carry out certification exams in the region to support the practice of medical physics through certification program in accordance with IOMB guidelines. This certification board was, accepted by some countries as a recognized, board, and a number of board exams were organized in MIFOM countries: Saudi Arabia 2019, Jordan, Qatar, and also before Corona here we're in King Faisal Hospital in Riyadh. This is the profile of medical physics in the Middle East. 12 medical physics societies. The total number of physicists is about 1,200 physicists. The majority of physicists are in Saudi Arabia, as you can see, 60% of physicists in Saudi Arabia, and followed by Iraq, 9%, and then Jordan, 7%. The first society to be established is the Lebanese Society, was established in 2005. If you compare the number of medical physicists in the region compared to other parts of the world, you can see that there is a big variation and unequal distribution of medical physicists. About 70% of all medical physicists are located in North America and Europe. If you can see, this is about 9,000 physicists in Europe, 9,000 in US and Canada, compared to the numbers in the Middle East region. And this 70% of physicists are serving only about 1 billion population, compared to the remaining 30% of physicists serving the rest of the world, about 6.5 billion population. So you can see that there is clearly imbalance and unequal distribution That's why MIFOM always encourage, increasing number of qualified medical physicists, because you need a qualified medical physicist means having proper education, training, and also then clinical training. And this is also shown in the IOMP recent publication. It was published last month. You can see the IOMP survey showing the availability of trained and qualified medical physicists, which is critical for the provision of high-quality healthcare services, especially in radiation therapy and diagnostic imaging. If you see this graph, you can see that MIFOM region, have the lowest number of qualified medical physicists compared to other parts of the world. So, the availability of medical physicists varies widely between developed and less developed countries, and there are several challenges facing the medical physicist. I was just talking with Dr. Ahmed before entering this room that we face many challenges like lack of recognition of medical physicists, lack of training program, limited number of opportunities available for medical physicists. So we need to address these challenges and try to overcome it. So addressing these challenges will require greater investment in education and training. Also, to increase the awareness of how important medical physics is. That's why MIFOM is trying to raise the awareness of the importance of medical physics in radiation oncology, in medical imaging, also in radiation protection and other parts of other applications of medical physicists. So I will give you some example of MIFOM actions to empower the profession by supporting professional development, involve and organize and be part of any education and training program that can improve the status of medical physicists. That's why we are here. Thanks for Dr. Nadim's invitation. We're always happy to cooperate with any health professional like Mistro and other organizations, because by the end of the day we have the same mission to increase the standard of care and for the benefit of patients. So these are some examples. We organized before a few months a big conference in Oman. It was a successful conference with different tracks: radiation therapy, medical imaging, and health physics. Also, during Corona, we also organized a virtual conference with more than 3,000 attendees and renowned speakers from all over the world. Also, effective communication is a really powerful, key to increase awareness of how important the services provided by radiation therapy, by medical imaging can be. So part of our effort is to be very active in sharing the knowledge through social media, through podcasts. Thanks for my colleague Ahmed. He's a very active media specialist, Ahmed Shukri. So we recently organized or supported a podcast for medical physics podcasts. We hosted many guests from different fields, and the feedback we received from the viewers and from the people listening to the podcast is very positive. So this is very important to exchange ideas, information related to the field of radiation in a very simple and clear way. Partnership, again, promoting cooperation partnership among medical physics and other healthcare societies in the region and globally. Also to enhance confidence, MIFOM recognized the significant contribution of medical physicists, and to promote the highest quality of medical physicists, we offer 2 awards that is presented annually. One award for the best young scientist, and the other is for the very active outreach and engagement. It is provided for medical physicists active in the field. So The future, this is how we see the future. In the short term, we want to promote the highest standard of education and training and research in the region for medical physicists. Then we also want to increase the effective communication to enhance recognition of medical physicists in the region, ultimately to ensure the sustainability of this profession. So this is ultimately to advance the medical physics profession in the region. So sustainability is to preserve and enhance the service, which is a key priority in moving forward. We are committed to find sustainable ways to providing effective and efficient medical physics support to healthcare providers and to medical physicists, to ensure patient care that is safe and of high quality. Okay, the final 2 slides of my talk, I would like to take this opportunity to honor the winners of this year's awards. We have 3 awards. The first one is the IDMP, the International Day of Medical Physics Award, which is presented for only 1 person from each region. So we have the winner here with us, which is, he received this award not from me, from the International Organization of Medical Physics, IOMP. So I would like to invite the winner of this year, Dr. Rifat Al-Mazrou, to receive the certificate. Oh, okay. And MIFOM Award for Young Scientists goes to Dr. Ahmed Subahi from College of Science and Health Professions, King Saud University. Dr. Ahmed. And the winner of Outreach and Engagement Award is Dr. Mariam Al-Hashim. She's not here, but we would like to congratulate her. This award is given to medical physicists from the region to recognize significant contribution in increasing the public awareness and understanding of the profession. Okay, thank you very much. Thank you.